So the story of how we got from Calgary to the Cowichan Valley started in 1983 when Robin was the director of a psychiatric inpatient unit at the Calgary General Hospital. My name is Lou Mackey and I am the partner of Robin Routledge. Robin and I met in Calgary in 1975 and we've been traveling together pretty much since then. Of course, we did all kinds of crazy things. We moved to a farm, even though both of us were raised in the city and had chickens and sheep and horses. Robin came to Vancouver Island and looked at a number of communities here and picked Duncan, picked the Cowichan Valley.
I got to know Robin when I was residing in Prince George on the territories of the Lheidli T'enneh people, and we were both on the board of Doctors of BC. Robin really stood out to me as being a very interesting and wise individual.
When I first met Robin, I was quite impressed with his energy, his creativity, and all the work that he was doing, both sort of locally in Duncan and Cowichan, but also his long-standing participation in the Milan group and really trying to advance family therapy.
I first met Robin Routledge in the fall of 2018. I'd been asked to serve on the Joint Standing Committee on Rural Issues. Robin was also a member and invited me to drive with him up to Pemberton for a meeting in the fall of that year. And during that time, I got to know Robin a bit and was impressed both by his life story and also his compassion, energy, and enthusiasm.
As a specialist, one other sort of characteristic of Robin that really impressed me was his commitment to interdisciplinary collaboration, but also his unwavering commitment and support for local family physicians and really taking a collaborative approach to ensuring that patients in Duncan and Cowichan and the surrounding communities were kind of receiving the best care that he could help provide.
I've always been really, really impressed with Robin and his depth of really compassion for his colleagues, for patients, for community, for the people around him.
So things really changed for Robin because he went from this big academic job to a rural hospital where he was doing general psychiatry.
For many, many years, despite being a busy clinician, and he would continue to make sure that the sports fields locally were mowed. So he'd ride his tractor and would just make sure that the local teams had a proper field to be able to play on. And I think that just really kind of illustrates how he has committed to the community.
I'm very proud of you, Robin, for how you have developed your practice and your humanity in the Cowichan area and how we have raised our family here. It's been a really wonderful, darned, lost it there for a moment, a wonderful experience.